I'm Dr. Sulagna Chakrabarti, the resident prosthodontist at Saritha Implant and Aesthetic Dentistry. Today, I'm going to talk about the types of dental crowns. So, your natural tooth composes of various layers. When they get damaged, either due to some sort of physical damage or decay, that is when we have to replace it with crowns. Now, dental crowns can be of various types. The most common four types of crowns are metal crowns, porcelain fused to metal, zirconia, and emax or lithium disilicate crowns. Solid metal crowns have been in use for the longest period of time. They can be of various types. Either they can be made of a noble metal like gold, or they can be a combination of lesser noble alloys like cobalt chromium or nickel chromium. The benefit of this is they require the minimum amount of preparation and they are malleable. So they are able to resist forces in the mouth very well, even in the thinnest of sections, and they do not cause wear to the opposing teeth, thus preserving them in the long run. However, the very obvious disadvantage is they do not look aesthetic. They are not the color of our natural teeth. That's why there have been many developments, the first of which is the porcelain fused to metal crowns. Now again, this has been in use for the longest period of time, and a beautiful porcelain fused to metal crown has been the restoration of choice for centuries now. The benefit of this again is the metal provides a strong base, whereas the porcelain restores the aesthetics of the teeth. However, the disadvantage is that the porcelain is, since it's a dissimilar material on the metal, it can fracture or it can chip off. Then somewhere around 1991, that is when pressed ceramics, lithium disilicates were discovered. By another decade, Ivoclar had perfected their materials. So what essentially happens is the porcelain is melted, and at a certain temperature, it is pushed into a mold, thereby forming the shape of a crown. And all of this is a very, very good restoration in terms of aesthetics and function, since it is made up of a single material. There is no addition on top of it. So the chances of fracture or breakage is very less. Another benefit of emax or lithium disilicate is that they are very, very aesthetics and are popularly used for anterior restorations. The last crown is zirconia. Now we have all heard of zirconia crowns, but we don't know what it is exactly, right? So zirconia can be classified as another type of metal-free crown, which essentially means that it looks and feels exactly like a tooth structure. It has a very high flexural strength, so the chances of it breaking or cracking in the mouth is very, very less. It is usually used for posterior restorations because the translucency or the amount of light that passes through it is a little less, so it may tend to look a little opaque. Posterior means the back teeth, anterior is the front teeth, and but there are many innovations which have come now. Multi-layered zirconia, translucent zirconia have been worked on, and these are again a very viable option for anterior teeth. And that's all for the types of dental crown. Thank you.